What we're going to do today is we're basically going to give a brief overview of eating disorder treatments in adolescents, provide a definition and a description of what is pro-eating disorder or pro-ED activity on social media, and then also discuss clinical implications and potential ideas for interventions in community settings, clinical settings, school-based settings, etc. And we'll have time for questions at the end, and if, depending on what you guys want to do, we also have an interactive thing that we could do also, because it's kind of in the afternoon and maybe people are getting tired. So keep it open for what you guys might want to get out of this talk. All right, so just really briefly, eating disorders are psychological disorders that have physical ramifications that are life-threatening. Anorexia nervosa is characterized by inadequate food intake, restricting your food intake to a point where somebody is maintaining a weight that is clearly too low and clearly unsafely too low. An intense fear of weight gain or denial that the situation is as severe as it is, and then self-esteem related to body image. Bulimia nervosa, frequent episodes of overconsumption of food or binge eating, followed by compensatory behaviors like vomiting, use of laxatives, excessive exercise, etc. Binge eating disorder is very similar to bulimia nervosa without the compensatory purging behaviors. And then otherwise specified feeding or eating disorders. There's a wide variety of other eating disorders that fall under this umbrella, but some of the more common ones are anorexia nervosa or bulimia nervosa that don't quite meet the severity criteria for like how low the person's body weight is or how frequently they're binging and purging. As far as prevalence and statistics go, it's pretty well understood that eating disorders are fairly overall pretty underreported. So these numbers are considered to be underestimations. Like these are numbers for the United States. So the 0.5 to 1% of women that suffer from anorexia nervosa, or the 1 to 2% of adolescent and young women or young adult women affected by bulimia. But I think we can all kind of, when we think about these statistics, we can all kind of acknowledge that the body image and disordered eating affects adolescents in much greater numbers. So the bottom statistic with 1/5 of teen boys and 4/5 of teen girls being unhappy with their bodies, or the second to the last bullet point with 38% of adolescent boys and 50% of adolescent girls engaging in extremely unhealthy weight control behaviors, such as smoking cigarettes to suppress their appetite, skipping meals, taking diet pills, etc. Okay. Etiology is multifactorial, so there's multiple different factors that are involved with the development of an eating disorder: psychological, social, interpersonal, and biological. As far as treating adolescents who have eating disorders, we take a coordinated team approach. So that always includes a medical provider, a nutrition provider, dietitian, and a mental health provider. And then that also may include a psychiatrist, family therapy, skills-based training for parents, group therapy. Some of the guiding principles with treating adolescents who have eating disorders are that family involvement is essential. We focus on re-nourishing the body before, it's the first and foremost goal, is to provide the patient with enough food so that their body is well nourished and their brain is well nourished, so that they can eventually engage in therapy effectively. The earlier the intervention, the better the prognosis. And also, we really work hard throughout the course of treatment to separate. It's called narrative therapy. So essentially we're we're working with the patient and their family to help that individual develop, who am I? Who am I developing into as an adolescent, as a young adult, and separate that from this eating disorder identity. So the more successful we are at achieving that separation, the more successful the treatment ends up being. In addition to nutrition, again, nutrition is very key. In Adolescent Medicine Clinic at Seattle Children's Hospital, we actually utilize our nurses on the treatment team as the primary parent educators. So when the nurses meet with parents at the beginning, when the patients are diagnosed with an eating disorder, the nurse talks to the parents. It talks to the parents about monitoring all kinds of things. So, the parents are responsible for feeding the teen. They're also responsible for setting limits around how often they're using the bathroom so that they can limit purging, setting limits on how often they're exercising, etc. But another limit that we recommend that parents set is how often the teens are online using potentially pro-eating disorder support with their friends online. And we don't really have a lot of knowledge about, basically this has been a really interesting project for Alina and I to do together because it has sparked a lot of conversation with my colleagues, other clinicians in the clinic, and also with parents, just to recognize if they're getting support. It's one thing to cut a teen off from using their computer, but it's another thing to cut a teen off from quickly getting a message from their friend on Twitter for how to trick their parent or their treatment team the next time they're at the doctor's office. So anyway, there's a lot of opportunity for more research in that area, and I think Alina is going to talk a little bit more about the research in a minute. But I just also wanted to make mention of my role on the treatment team as the nutrition professional. Alina's going to talk to you guys about some of the misinformation out there in the pro-eating disorder world, but I think I just wanted to make mention that part of my role on the treatment team is to kind of provide a safe space for patients and their families to talk about do some nutrition myth busting around what is fiction and what is fact about the science of nutrition. So we end up going through a lot of kind of just breaking down some of this information that we get about nutrition and then reframing it to talk about how does this information apply to you in your life and what is the next step for you to support your health. So some examples are, just this idea that a calorie is a unit of energy that provides fuel for our bodies. Definition of all the different essential nutrients, things like carbohydrates, proteins, fats, vitamins, minerals, water. What do those nutrients actually do for our body? A common one that I end up talking to teens about a lot is this idea that the nutrient fat and the fat on our body is not the same thing. So it is a myth that if you eat something that's high in fat, it goes directly to fat on your body. That is not actually true. But we talk about what is the essential function of the nutrient fat, what is the essential function of adiposity on our body. Obviously, too much of either is not healthy for us, but too little of either is not healthy for us either.
All right, so I'm going to talk more about the in-person social context for basically what it's like to have an eating disorder. And some of this you might have heard also in my talk this morning if you were at the Pro-Eating and Social Interaction on Twitter talk. So eating disorders become these really core parts of patients' identity, as Laura mentioned. These thoughts about all these different ways to reduce caloric intake and also at the same time avoiding these urges to binge and control the pangs of hunger really consume the thoughts. There's also a lot of stigma against those with eating disorders. So those with eating disorders are and feel ostracized by parents and by peers. And there's also that ambivalence that Laura mentioned about recovery. This is really characteristic of eating disorders. And the need to conceal the symptoms of eating disorders from their concerned offline relationships kind of alienates these patients from their in-person social support networks. So eating disorder patients will often lack social support. At the same time, online socialization and information seeking is anonymous, so they don't have to worry about repercussions from their offline ties. So it's not surprising that this pro-eating disorder movement arose. Pro-eating disorder movements include pro-ANA for anorexia and less commonly pro-MIA for bulimia. These aim to support those with eating disorders to attain and maintain extreme weight loss, but through maintenance of disordered eating habits and thoughts. It's also important to note that there's a spectrum of ideology, so while some content will go so far as to say that anorexia or bulimia is a lifestyle rather than an illness, there's also some content that will display this openness to a struggle with recovery. And this kind of makes sense given that ambivalence, again, that's really common over the duration of the illness. And just like the content varies in ideology, also the users themselves might use pro-ED sites, but they vary in their level of support and how positive their attitude is towards pro-ED and EDs in general. So research has established some common elements to these sites. These sites might include websites, forums, blogs, and also more recently social media. So some elements are Thinspiration, or Thinspo. This is used for any kind of like image, clip, quote, or even like lyrics that are used to create the illusion that emaciated bodies are beautiful and desirable. These cyberspaces are also sources of information exchange and misinformation exchange, as Laura mentioned. So they'll provide tips and tricks, but these are tips and tricks for unhealthy weight loss methods and concealment of the ED symptoms from offline ties, and even sometimes sharing like tips on how to conceal while in treatment and about maybe a specific treatment center. Finally, these cyberspaces contain interactive elements like forums and message boards and things like the ability to post pictures. On social media, we see things like, you can obviously follow or share to kind of get at this information and socialization. So pro-eating disorder viewership is pretty common among ED patients, but it's also just easily accessible and interactive to all adolescents. Pro-ED is publicly prevalent across a variety of sites visited by young people, so it's highly accessible. Just like researchers can get at these sites with just a couple Google searches, chance viewership among curious adolescents and young adults isn't that all uncommon. So one study, for example, indicates that there's over 13.2 million searches for pro-ED websites on Google annually. Another study found over 500 sites about pro-ED on Facebook in fall 2008. It's also been additionally estimated that these sites might outnumber pro-recovery sites at a ratio of 5 to 1. So it's important to keep in mind that while accessible, these are also really interactive, and there's this like visual appeal to all these like images and things that can be really enticing to adolescents. So viewership might be accidental or out of curiosity, but we also know that specifically among diagnosed ED patients, viewership is relatively common. At the same time, viewership often will go back and forth between looking at pro-recovery sites and then looking at a pro-ED site, maybe in the same time that you're looking on Google. So one study found that among 76 U.S. adolescent patients with eating disorders, 25% visited pro-ED as well as pro-recovery sites, and 10% visited just pro-ED sites, but usually it's that mix of content. So regular visitors to these and contributors to these pro-ED sites include a mix of diagnosed ED patients, and they also include individuals who might not actually reach the criteria for diagnoses or haven't sought treatment or haven't actually been formally diagnosed, which again makes sense given the covert nature of this illness. So first I'll just put up a position statement that was released by the Academy for Eating Disorders. This is the world's largest professional organization for those who work with individuals suffering from EDs. This is getting at kind of a general summary of the clinical implications for pro-ED websites. Basically, there's this idea that there's this clinical concern about the proliferation of pro-anorexia websites and that they pose this, a danger and promote anorexia as a lifestyle and provide this social support for pro-ANA. So similar position statements to this have been released by the Royal College of Psychiatrists in 2009, as well as the Society for Adolescent Health and Medicine in 2003. And there's a large body of empirically grounded research that underlies these concerns outlined here. So the social support that's received on these sites comes with the feeling that members are part of a pro-ED movement or a specific pro-ED network of users. And there's this documented need to display one's authenticity as a pro-ED user to prove one's status or prove that one really is anorexic or bulimic offline. There's competition among users, and we know that in the offline setting, this competition is characteristic of bringing people with eating disorders together. Online, there's both implicit competition to prove one's status and to show self-control, but there's also explicit competition in the form of very formalized competition, such as directly messaging in the number of calories you had that day and the amount you exercised to see who basically burned off the most calories or intook the less, didn't take in very much. So what's happening then in these cases is that users are basically competing to see who can engage in the most destructive behaviors. There's also that exchange of information that I mentioned that's extremely common, and it's known that users will not only first learn of tips and tricks for unhealthy weight loss and concealment, but also actually utilize them following first learning them on these sites. So socialization and expression of eating disorders with this underlying pro-ED attitude clearly cultivates that eating disorder identity that Laura had mentioned. And cultivation of this identity can just serve to entrench a patient further into their distorted thought process. As the patient's becoming more entrenched in this ED mindset and more malnourished, this process can derail their offline treatment efforts to nourish the body and show them that they have a life worth living outside of the ED identity. 3 major case control studies have contributed evidence that viewership of these sites results in negative ED-related outcomes, even among healthy viewers. There's also a number of associational studies that have shown that there's this link between viewership of sites like this and ED outcomes. So I'll just go over the 3 main case control studies. So it was found in 2 of them. One was a pilot and then a follow-up study that college women who viewed pro-ANA sites experienced a decrease in perceived attractiveness and an increased perception of being overweight. In another major study of almost 1,600 just general college women, researchers found that after modest viewing of pro-eating disorder websites, participants expressed disordered eating symptoms, significantly reduced calorie consumption, and also had emotional disturbance for up to 3 weeks after the study's end. And again, there's numerous other associational studies that have also kind of backed up that there's this pretty strong link between pathology and site visitation. So what these studies provide is this growing body of literature that links risk factors and symptoms to disordered eating symptoms among both healthy individuals as well as those with pre-existing disordered eating. So now I'll turn it back to Laura so she can discuss her thoughts about pro-ED in the clinic. Okay.
What I was talking about earlier summarizes it, that piece that we're trying to support adolescents to develop into what gifts and talents do you have? What are you passionate about? Who are you becoming? And essentially separate themselves from this eating disorder identity. But I guess we just wanted to talk a little bit more about the tips and tricks. As a clinician who treats eating disorders, especially in our clinic, we have medical providers and nutrition providers, and then of course nurses and medical assistants, many team members who are helping to support us to do our work, but really we don't have a psychologist actually in our clinic, and so we're there really to hold our patients accountable for how is their health physically recovering. So you're telling me that you ate this, but your vital signs and your weight say this. So we're very accustomed to kind of being tricked essentially by our patients, and it's not anything personal. It's just part of the recovery process. And I guess I just wanted to make the comment that this kind of re-emergence of pro-eating disorder activity through social media just essentially gives our patients more tools to trick us. Is there anything else I was going to say about that? Okay. So I think basically, like I said at the beginning, I'm just really excited to be here to have a discussion and see what your guys' thoughts and questions are, if you have observations about how this plays out in your various settings working with youth. And really, I'm just excited to get the dialogue going. I think one thing that came to mind as far as what to do about this for me is to start talking about media, working with youth and developing media literacy, developing a sense of how do I take a step back and, kind of think about what it is that I'm doing. What am I putting out there online? How do I just kind of being aware of how do we present ourselves. So I'll show you guys a really interesting media literacy tool in just a second. I just wanted to make the comment too that this has been an interesting process for me because for 7 years before I became a dietitian, I was doing media literacy education as a volunteer, like pretty intensively as a volunteer. And then since then, for the past 7 years, I've been a clinical dietitian and I've kind of been out of that world. And I just think it's interesting to kind of get back into this topic because if you look at, this Dove campaign for real beauty, has anybody seen this? Has everybody seen it? Do you guys want to see it again? Yeah. This came out 7 years ago, and I just think that it's interesting that, if you think about the past 7 years, how much we're bombarded by these images, it's just pretty much exploded. So do we have audio? Oh, I have it on mute. Okay. See if it works. Is that just the website or the? Oh, cool. So, let's see. When I was back in the day, when I was doing this, when I was doing the media literacy thing, it was pretty simple. We would break students into groups and we would have them, critically kind of take a step back and look at this image and what does it mean and what are the images shown, what are the words used, what is being sold, what's the overall message. But I just think, like I was saying, it's kind of exploded since 7 years ago as far as how often we're bombarded with these images that are not even real people. This is a really cool digital media literacy toolkit. It was developed by, we'll see if it works. It was developed by Bobby Eisenstock, who is and her undergrads. She's a media literacy professor at Cal State Northridge, and she actually used her students. Her students essentially developed this so that it's current and up to date. And she has, I think she did it through a service learning project, service learning. And so they also are partnering with the National Eating Disorders Association. So this is, it's available to anybody. So educators can use it, or people who work in community settings with youth can use it. And then I spoke with Bobby, and she is going to continue. I don't know if she has a grant or what exactly she has, but she's going to continue to draw input from her undergrads every year so that it will continue to remain current. So it's really, it's going to take forever to upload. And then I just wanted, while it's doing that, just wanted to show you guys if anybody is interested in advocacy or coalition building or just doing some more work around this, the National Eating Disorders Association is actively involved in providing accurate information. Alina mentioned the 1-to-5 ratio of
pro-recovery sites to pro-eating.
Yeah, pro-recovery to pro-eating disorder. So there's a huge amount of misinformation and negative information out there about eating disorders, but the National Eating Disorders Association is on Facebook and Twitter and Tumblr, or they advise Twitter, Tumblr, Instagram, and then they're involved in legislative advocacy. So I just wanted you guys to have these resources. If anyone wants me to email them to you, let me know. Because the National Eating Disorders Association website is actually kind of hard to navigate.